All right, so first of all, thank you for your trust, and it's they call it in Hebrew basher, when it's like meant to be, it's fate.
Okay.
That you end up coming here to see me with that condition, because it's as I was telling you, it's the hardest thing to actually treat. The reason it's so hard, and why does it even happen? The reason it happens is there is inflammation in the cartilage. And inflammation in the cartilage can take place for a variety of reasons. One, from sun damage, the other one is from physical trauma. And what happens is, as we get older, it means partly it's my theory, as we get older, the support tissue around the skin, is lost. We get a little atrophy of the fat. And you look at it, it's like, oh, how much fat do you really have there? Not much, but there's enough fat under the skin to be like on the mattress to prevent you from feeling the springs. Mm-hmm. But right underneath it there is a cartilage, and when you lay on the side, you slowly put pressure on that area, and you have like pre-decubitus ulcers. So it's before you get like a wound from laying mm-hmm. on it all the time, and it causes tension on the already inflamed cartilage. Cold, other things, all them cause a little inflammation there. And then eventually, once it's inflamed, the pain is insane. Not when you don't touch it, but the moment you touch it, you can jump, you can't sleep. It's torture. What things have been done in the past? Well, any form of removing that inflamed cartilage or trying to reduce the inflammation. Steroids, unfortunately, don't work. So topical or injectable steroids, they don't really work. They can cause more of that atrophy of the skin. So if anything, potentially it could actually make it worse. The cartilage can be cut out, and I've done it on occasions, and you cut out that inflamed cartilage and it's good. Usually it doesn't come back as long as you take the entire area where the cartilage was inflamed. And you can do it either with surgery, or you can do it with liquid nitrogen, so you spray it. But liquid nitrogen by itself is very painful, and it's traumatic, and it's not precise. So it's better if you decide that you want to remove that inflamed cartilage, that you do it that way. But the best way of doing it is if you can revive that cartilage, give it what it needs, because it's basically like a baby crying, and it's telling you, please help me. And you're saying, well, shut up, kind of slap him out, or give him to someone else so you can hear him crying. And that's kind of cutting out that piece of cartilage. Instead, what you can do is try and figure out what it needs. But because it's hard for us to understand what it needs, we have the theory, I believe it's related to all damage that was there, loss of the fat. If we can give the body the necessary tools for it to regenerate naturally, then beautifully. So the question is, how can we tell the body, here are the building blocks, go do whatever you need to remodel the ear so it doesn't hurt you again, and you don't have to keep calling my attention to it by crying. Well, here comes this amazing innovation using the extracellular vesicles that are carrying the information from the mother. So when you're getting exosomes, those are the messengers, kind of like a little emails or SMS messages that the body sends to other body parts asking for help. And if this is asking for help, and if you I wish I could not be interrupted with my brain would be that perfect that I could not be affected by that. But when you want to have the message for proper healing, you think to yourself, all right, when was the most effective time when the body gave information for itself to heal? And that's when the embryo starts forming, when the baby starts forming. Because you think to yourself, from an egg, it forms this amazing, complex human being. How does it form? Well, actually, it's from the exosomes that gives the signals to the body how it needs to develop. And so you take those exosomes, which before they used to think is just waste product, it's garbage, and you put it into the area that needs to rebuild. And if it could rebuild the heart, and it could rebuild the bones, and do all this complex interaction, guess what? It can also give the necessary messages for the ear to rebuild, because every cell except the red blood cells has the entire makeup of the entire DNA. And this is the message that gave the body the proper formation. So you take those exosomes, they call them H0 from the stem cells, you milk them like a cow, you milk just the thing that you want, and you inject it there, and then that gives the body the necessary building blocks. And then what you need to do is you need to have also your natural vascular supply there, plus your natural energy. So all it does is it gives you the infrastructure to build it, and then it depends on your health in terms of your energy to build it, to use those tools to build it back.
And how many treatments are necessary?
So that's an excellent question. The lady that you saw, the one on the YouTube, which was really bad, she was worse than you. And she was referred to me from one of my professors who taught me at Columbia when I did my residency. She did less billions of exosomes each time. Can you give me the general exosomes, please? We're going to use it. And so she did it over, but she was also older. She did it over 2-3 weeks, where she came, I think 3 times, and we injected each time a little bit. I mean, it's a small area. How much can you inject? So I could divide these injections into a few times. It's a little pain to come here a couple of times, but I can do that. Or I can try and put the entire thing right away in one shot, which is the pain just because there's a lot of fluid that goes into that area in a short period of time. So you'll tell me. All right, so.
You might want to make me lie back a little bit.
We will.
To pass out.
We will,
So.
yeah, not a problem. Can you make her lie down?
Yep.
So this is the stuff that I'm going to be using. I'm just going to clean it. I'm just going to.
I may curse.
That is fine. We'll bleep it.
That's right.
As long as your bleep meter's working, we're good.
So now we're going to do the math. There's Nastya, your math is good.
Is
So
there an
if we have,
advantage to doing all of it at once versus doing it in separate parts?
I love the question. For that, I would need to have done many cases to tell, but
Okay.
based on my theory, there is advantage in doing it over a longer period of time than over one, just because the volume itself causes some tension in the area.
Okay.
So if, for example, I would have to tell the general company, okay, I've got a lot of chondrodermatitis, nodularis, Hill's conditions, I know it's a mouthful. Chondrodermatitis is inflammation of the cartilage. Nodularis because it looks like a nodule. Hill's is because it's on the helix usually, but yours is on the anti-helix, the stuff that goes against the helix, the second. I would tell them, I want this 100 billion in a tiny thing, and then yes. But the volume also causes a little bit of, even though it's good stuff, putting a lot of good stuff could be also, bad in one time, because your body either will be like, oh my God, I got so much money, I don't know what to do with it, and you're like, I'm not going to do anything, kind of thing. So it's you have to have a balance. I agree with you.
Better to do like with two treatments?
Yeah, 2 or whatever. Yeah, it's better to do. But you know what? Maybe I do the one, and you don't need the second one. We would love that. Now, while it's healing, the other thing that I want you to do, we're going to give you a little silicone that you'll put on top. It'll be like a secondary skin. It's almost like you're putting yourself a soft little pillow. It's not really. It's just a bluish kind of translucent thing that you'll put on top. It'll give it a little extra, the fat that it's missing, you can say. So while it's healing, it'll not be as traumatized.
Okay. So I'm going to stop using the creams that I
Yeah, you don't need. They don't do anything. They don't do anything. Sometimes you come to a doctor and I would put myself into that equation because I used to be that part of doctor. I try to avoid it, not be that. We just give you something because we know if you don't, you'll be upset at us. How many times I came to, people would come to me, I was like, you don't need anything. And they're like, I waited 6 months to see you, now you tell me I don't need anything. So they want something. Even if it's not something that will help you, they want something. And there is a factor of this placebo effect. You really believe it will work, hocus pocus, and suddenly it works. But scientifically, there's nothing in an antibiotic ointment if there's no infection. If anything, it causes resistance by using it where you don't need to. It's kind of like giving an antibiotic when you have a viral infection. It kills only your healthy gut flora. It doesn't help you. All right, so let me do this.
So you're doing numbing first and then you're going to shoot me, or you just going for the go in?
No, I'm not going like, I'm just going to go in.
And how many injections?
Just one. Just one injection. You have a picture of the area?
Yeah.
All right, wonderful. So I'm just going to clean the area with a little alcohol. And you'll follow my instructions about breathing, and usually it helps you. Do you do yoga?
No.
All right, so yoga breathing is helpful. I'll teach you how to do it. You put your hand on, yeah, you have the right spot. And when I tell you breathe in, your stomach expands.
Okay.
Your diaphragm goes down, your stomach expands, and then you hold it.
Okay.
And then you start breathing out. When you breathe out, your stomach goes down. So let's practice. Stomach in, hold, 1, 2, 3, 4, and out. Excellent, excellent. So that's the right breathing. Good. Now I'm going to tell you before I do it. Don't worry. Just making sure. Yeah, I can see actually a wound over here. Damn. Yeah. All right, no problem. It will heal. All right, sorry. Here we go. I'm going to move the tray a little bit so I can go behind you.
Tell me to breathe.
Never stop breathing, please. So take a deep breath. Hold it, count them until 3, and when I say 3, breathe out. 3, breathe out. And smile at the same time, smile. Good job. And you're done, you did very well. That's it. Take another deep breath. Stomach expands, hold it, and slowly breathe out. You're doing beautiful. You're doing beautiful. Unbelievable. You can now give classes in yoga breathing. Yeah, you're doing very well. I'm very impressed by you. Very, very impressed. You did beautifully.
Well, I'm very impressed by you because this is nothing compared to what I had done at the dermatologist. I cried, I sobbed. It was awful.
I'm sorry for that experience. Good. That's how every experience should
be.
That's
this is great. Thank you.
Only pluses, no minuses. That's how every experience should be. So we're just going to put that silicone, and you can get that silicone. You can buy it and do it as well at home. And this is way too big what she just cut. She cut from her entire heart. You just need to make a small little thing. So we're just gonna cut you a small piece, and we're gonna give you the rest. And just
so this I would be using in place of a Band-Aid that I've been using.
Yeah, because the Band-Aid, the tape on the Band-Aid is very harsh, and will cause trauma by itself.
Oh wow.
So what you can do is you can give it that on a cardboard. Put it on the cardboard and give her on that. Here. So this is enough, and I'm just going to put that little thing there like that.
And how often should I change this?
When it falls off.
Oh, when it falls off, so I can just shower with it. All
Exactly.
That.
Exactly.
Wonderful.
Give her a mirror so she can see how it looks.
This is a mirror.
You see no bleeding, no nothing.
Lovely.
Okay.
Okay.
All right. So let's think when we see you back. I'm back on the 3rd because I'm going away.
I leave on the 6th for Florida.
Oh, perfect.
So,
Perfect. So I'll see you on the 3rd.
On the 10th.
All right, super. So if you want, I'll see you on the 3rd. We'll do, if we need to, and Asha. And if we don't, then beautiful. Mazel tov.
Okay. Mazel tov. Wonderful.
Okay. Happy holidays. Merry Christmas. Happy New Year.
Happy Hanukkah to you.
Happy Hanukkah to you too. Thank you.
This is a photo that the patient sent me 2 weeks after reporting the wound completely healed and that she has no pain. After the injection of 100 billion exosomes by Regeneral, this result is unheard of, because this problem usually does not resolve without surgery. Sometimes even after surgery it does not improve. Here not only did it improve, but it appears for now to be cured. Due to the patient's medical condition, she can only sleep on her left side, which will repeatedly traumatize the area and therefore the wound may reoccur. We will set up a plan to allow the patient to sleep on her left side while removing the pressure from this inflamed area on her ear cartilage.
I'm Nicole, a longtime patient of Dr. Levit's. He's helped clear my skin throughout the years. I had really bad cystic acne. I had a few flare-ups on my chest, so I came in for that today, and he offered me a laser treatment, which is a nice little Hanukkah present. Makes me feel great. It was painless, unlike most facial treatments. Feel nice going into the holiday season. My skin looks actively clear, which is great.
Nicole is a brilliant person, smart, beautiful, intelligent, everything, and she's at Harvard right now, studying MBA.
Yep.
So she'll be telling me how I can do better in the future. I don't know if I can afford her. I don't know if I can afford her, but that's the goal. So we're gonna.
No.
Thank you. So we're gonna put it on the spectra, and we're going to go ahead and do the laser on. So this is the Hollywood spectral laser by electronic cynosure. And what is nice about it is that you can get an effect without any downtime, without any side effect. The way it works is it uses heat in order to activate and rejuvenate the fibroblasts, which are the factories producing the collagen and elastic tissue. And also it heats up and rejuvenates the mitochondria, which are the powerhouse in our skin, and they provide the energy that is necessary in order for the body to do its daily activities, daily functions. Any pain? Mm-hmm. Besides that, also what it does is it uses the heat to break down the large globules of pigment that occur from either medications, hormones, sun damage, into smaller, more easily manageable particles that the body can then remove from the skin. There's no maximum amount of times that one can do it. I've done it once a week. The recommendation is usually once a month because, once a week people will be too hard for some people to come in, but you can do it once a week. And I specifically did it on one part of my neck to see the difference because I had a lot of sun damage. And I remember watching an influencer, and he was talking about longevity and about how you need to look good, and he looked bad. I mean, the guy's like, who want to listen to this guy? He looked like he had so many freckles, so much sun damage. I was like, no. I don't think it's just the dermatologist who notices that. What are you feeling right now?
Just honestly nothing really.
Good.
It's a little warm.
Good. And it's good, especially people go into the sun a lot, and we all do. We love the sun, especially people coming from cold climates, especially here now, that it's so cold and gloomy some days, that we're seeking the sun. Even when you use sunblock, it's not perfect, it's not 100%. Also, we get a lot of sun damage from the blue light, from the computers, from the phone. Do you have like a blue light screen on your phone?
No. I don't.
I can't believe that. And you're so advanced. You should, of all people, right?
I have like a red light that I turn on at night on my laptop screen to minimize the blue before bed. But
right. So it doesn't affect your melatonin.
Yeah.
Melatonin levels are a very important key for your ability to have the circadian rhythm and to sleep properly. Some people take supplements. The best thing is really to go always at the same time. Try to stick to a schedule. And if you notice, I'm trying to follow the skin, always keeping the laser in a parallel fashion to the skin. So if it curves, my arm curves also. You'll see it afterwards when you watch the video. And thank you, Nicole, for allowing us to show it.
Of course.
Any questions?
Now I'm excited to see the results. I trust you.
Thank you.
Whatever you say.
Thank you. All right. So feel like a brush stroke. I'm just going to finish the lip a little bit here because it's a little dry, especially in the winter months. You want to make it work on it a little more. You must be peeling it or biting it or whatever. You need to put a little more moisture, Aquaphor, so it keeps its own moisture on top. And it's safe to go over moles with it, so I've not seen any issue when you go over a mole with the laser, so there's no side effect. Just working on this area above to help reduce the chance of down the line wrinkles, so I stimulate the collagen there. The key with everything that we do, whether it's exercise, meditation, sleep, is to do preventive work, not only to do it for this moment, but also to slow down the process of aging. So all done, you did very, very well. Let me check how many pulses we did. 3,443, that's perfect. Wow, my God, that's excellent. So we can take it off, and you can right away look at the skin.
Looks great. Wow. Yeah.
You see, that's one of the rare lasers you can have no pain and yet see good results right after.
Yeah. No pain whatsoever.
Yeah, it's not much clearer. Do you agree, guys? You see it?
Very nice.
Very, very nice.
Thank you.
Happy Hanukkah.
Happy Hanukkah. Thank
Happy
you so much.
New Year.
Profession as a model.
That's right. Well, she's a model to begin with. Yeah, she's got everything. Got everything.
Yeah, working out.
Thank you. Thank you.
Thank you.
It was invented for eczema, for atopic dermatitis, but one of the most difficult things to treat is itch, and also finding the cause. In his situation, he had iron deficiency, and he supplemented with iron, and every time he would get the iron infusion, the itch would start, and they couldn't find any other way that they could reduce the itch. He needed the iron. They didn't find any other way except to give him the IV iron supplementation. When we started doing the Dupixent, instead of 2 weeks, every 3 weeks, the itch returns. So he knows that Dupixent is the thing that helps him. It's safe. It's been used it's approved by the FDA for 6 months of age and older, and it's the first thing that came out on the market to help the atopic dermatitis eczema, and now it's used for prurigo nodularis, which is like itching and nodules and stuff like that. Now he's not itching, yes? Сейчас не чешется тебе, не чешется уже?
No,
He's not itching.
no itching.
Yes, and before он себя расчесывал, да?
Thank to Dr. Levit, it helped me
It's not,
very much.
it's not me, it's the company that invented
Yeah,
that, but
no,
thank
but-
you. And they're doing it themselves. Before they used to come here, but they're amazing. They're doing it themselves. А кто колет? Ты его колешь? Он сам себе колет?
Нет,
А кто?
медсестра.
Ah,
Или к вам.
so a nurse comes to their home to inject it. Okay, okay, understood. All right, well,
Before you, I've been an 8 doctor. 8.
Just only you help him.
I understand. Okay, well, I'm happy I was able to help you, because let me tell you guys, if you're itching, you can't concentrate on anything else. It's like impossible, and you can't live your life.
Меня весь Бруклин знает.
Это не в Бруклине, пока это в Соединенных Штатах. Спасибо. I want to wish you happy Hanukkah, happy New Year,
Happy New Year.
Откуда
happy
я?
Hanukkah, happy New
Thank
Year.
you so much.
Thank you so much. Thank you.
А когда ему прийти на фул? Мы давно у вас...
Сделайте аппоинтмент там. Сейчас они вам сделают аппоинтмент. Да.
Okay.
Я голос потерял, извините.
Thank you.
Да, у них все это, да. Zero each score. Yes, continue. Yes. Blood work у него не показывает ничего там, что опасно. Так что он может продолжать. Yeah. Сахар у него высокий.
Да.
That's not got nothing to do with that. But you need to work on his sugar. That's very important.
Это уже все делал этот, уже ходим к эндокринологу.
Endocrinologist, but you need to take work on your sugar. You gotta work. Надо над сахаром мой золотой работать.
А помните, вы отправляли его на эти, как они, паразиты, вы ходили к тому доктору за $500.
Кожа
Да.
у вас
Как его
чистая.
проверить?
Кожа,
еще?
кожа чистая.
Его
или
уже
какие-то-
нету. Я не знаю как.
Да вроде бы чисто.
Ну, может, например, терапевту принеси его анализ.
Они это не
А
делают.
кому?
Сейчас никого нету. Честно,
что, он умер?
нету.
Боже,
Он не хочет
старый.
работать. Он не хочет работать.
Он уже пожилой.
Не хочет
Через
работать.
сколько прийти? Только на полный осмотр или еще по поводу
Да.
Dupixent он должен follow-up? Через сколько?
Через 3 месяца
Три месяца.
на проверку аппоинтмент. He had also, we found a parasitic infection. We treated the parasitic infection and he got better. We sent him to a special person who used to treat the Pope, the President, a lot of the top people. Unfortunately, during COVID, he stopped working. So there's really nobody else to replace him. Was on 5th Avenue and 65th Street. His office, when I used to have an office on 6th, 9th and 5th in Manhattan, we used to work close together, but He's the amazing guy. Dr. Kevin Cahill was his name of the guy, but he doesn't work anymore, unfortunately. And so finding someone who can examine the stool under the microscope himself for parasitic infections, this is an art that has been lost in the United States, and I hope it will come back, because we're all doing all those lab tests, the MRI stuff. We lost our ability to utilize our own hands and the signs that are there, like you saw me reading the nails, or the color in the face, or the breathing type, or the changes in the skin. We lost that, and we're just dependent on all those outside tests, which are not necessarily that good, and they miss a lot of stuff as well. So you gotta get it back. Hopefully they'll get back in our medical schools. All right, so next patient is one of the more common conditions that I see, which is acne. And she's very graciously allowing us to videotape the conversation, which I think is more telling than even looking at her face. Different treatment options, and she's tried them all before she came to me, and her mother, who is a wonderful, very talented, famous lady who works on nutrition, everything healthy, has tried a lot of stuff as well, and she sees that this is the moment where she actually needs a medical dermatologist advice. So we're going to go and we'll listen to the discussions. So I'm here with a lovely young lady for the first time I'm seeing, and she has a very common concern that I see a lot, and graciously allowed us to share the story. So tell us a little bit about.
So I've been struggling with acne from, I would say, middle school, but when I look back at pictures now of myself in middle school, it's not as bad as I remember it being. It looks like my skin was pretty much clear, but I do remember, when I think back, I remember trying all these products, salicylic acid, benzoyl peroxide, a lot of these astringents that burned my face, that since then I feel like I've been struggling with redness, and I still can't use benzoyl peroxide because I get very red. So I remember my breaking out from middle school, but I don't remember it being very bad. It would just be 1 or 2 pimples, but it would be more than my friends were getting around me. So I felt as if I was struggling with acne, and it kept getting worse. The pimples just kept getting worse, especially I noticed from COVID on. After COVID, I went to college, and those 4 years that I wasn't living at home, my skin was definitely worse than it has been. This year, I started law school, and that came with a bunch of new stress, and I feel like this summer my skin cleared up. I was in Greece, even when I went to the beach, I didn't feel like I needed that much makeup, and then something happened this fall that I think my acne got even worse than it has been, but I've always been struggling with this, so I think that certain things cause it to flare up. I don't know what it is, and I'm tired of waking up with a new pimple every day, and I'm tired of needing makeup to leave the house. I've been frustrated, so I've been waiting to get an appointment with you, and I didn't know what to do, so I made an appointment to go to the city to just see a dermatologist because I was so frustrated. I have to leave the house every day, see people, and all I think is that they're staring at my skin. They're looking at this pimple, and I know it's worse for me than it is for other people, but it's very hard on me mentally. I'm already so stressed because I'm in this stressful space of my first year, and then I'm also worrying about my skin, and I don't want to worry about it, so the dermatologist suggested spironolactone. I started November 27th, so it hasn't even been a month from this point. I am on 50 milligrams, take it once a day. I also use adapalene gel at night and Winlevi over it, and a moisturizer, and I use Winlevi morning and night. I do notice that I break out more when I'm ovulating or around my period. I really notice that I start to break out more than other periods of time too.
Okay. Have you checked your potassium levels? Did he tell you need to do blood work?
No.
So one of the things that you need to do when you take spironolactone, which is a diuretic, is you need to check your potassium level unless you supplement with that. Your mom is like the expert on health and supplementation. Has she tried any supplementation for you or talked about?
I mean, I take daily. I take vitamin A, vitamin D, zinc, fish oil, probiotics, take DGL for my stomach. I take a lot of supplementation also for my gut because I've been struggling with my gut and maybe that has to do with my skincare. So I have been working on supplementation, but I don't know if it's specifically related to potassium or
Right.
it's just more overall body.
Very, very smart. So everything that you're saying is very impressive. I would have to say that, making my life much easier. Everything you said is correct. They used to laugh in the 80s at the idea that stress causes acne. And I always thought as a teenager when I had my acne that it definitely is caused by stress. And it's been proven that it is. And the way stress works, and it can be emotional stress, studying for an exam. It could be stress because there is an issue in the gut with the bacteria, not eating the right time, not sleeping the right time. It causes an increase in your adrenals, production of the hormones that lead to the hyperproduction of the oil. So your oil glands get hypertrophied and they produce more oil. And when you have more oil, you develop more traffic of the oil. And if genetically you are sensitive, like allergic to the byproduct of the bacteria of the P. acne, which is the most common type of bacteria found in those pores, in those oil glands, then like any allergy, you will have a response to it. Your body will try to push the allergen out and it will try to fight against it. That's why you have the pus, that's why you have the painful pimple, and that's why it tries to push it out. And sometimes it even tries to form a scar so that it won't be able to find its way back into the food supply. But this bacteria are very tricky, kind of like terrorists. They're digging tunnels underneath back to that food supply. So acne would work great. And if you want afterwards, after we start acne, we can also do the AviClear laser. But do that just so you don't have to do the acne for a long time. And once you also have less acne, the AviClear, when you do it, will not cause purging. And some people take antihistamine like Benadryl or Claritin, Zyrtec before, so they don't get purging during the AviClear. But if you take the Accutane, that low dose, I rarely say 100% because in medicine there's no 100%, you'll get better 100%, and you'll not have the purging 100%. You can continue the topicals, no harm, with the Winlevi, using it twice a day, and the adapalene. Don't waste your time on that, in my personal opinion.
Really?
Yeah. Regarding the scars that you already have, there is a procedure that we do. It's called Secret RF. It's microneedling with radio frequency that helps build collagen and also shrink the pore size, and it's very, very safe, and you can do that on your face. I like to do it with the exosomes. Actually, we did it for one lady. She already had the acne gone, and she just wanted to do she did Accutane also. She was on the video. You could see it when you will watch Dr. TV Network. You'll be able to see us doing it for her for scars, and she had already a session before she improved, and I was doing a second session for her. So that's something you can look into afterwards whenever you want to do it, when you have time with law school. And the other thing is less stress. Easy to say, hard to do, I know. In terms of the supplements, do you do blood work to check your levels?
I mean, I did blood work in July.
Did you check your vitamin levels, the zinc and all that stuff?
Everything was okay.
Did you check the zinc and all that other stuff?
I mean, maybe not.
Okay, so what we're gonna do is this way. We're gonna female unfortunately has to do 2 negative pregnancy tests before they can start the Accutane.
Okay.
So we're gonna give you some topicals right now, and then we're going to start the paperwork for the Accutane.
Okay.
And we will, in a month, we'll be able to initiate the Accutane itself, but now we just need the urine pregnancy test. We'll check it, make sure it's fine. And then when you are on Accutane, they insist that you be on 2 birth control pills. All right, so it's very important to have the desire to look the way you feel. And very often I look at myself in the mirror and I think to myself, gosh, you know, this is a little bit loose, this is a little bit hanging. And it's not because I'm vain. I'm the last person who thinks of himself as vain, but the way you look reflects back on the way you feel. And it also reflects on other people. And so I have a lot of professionals who come to me and say, you know, chairmen of departments, and they say, I'm not an angry person, but everyone says that I'm angry all the time. What's wrong? And it's usually a simple thing where you can just do a little Botox, maybe open their eyes a little bit so it doesn't look like they're squinting all the time with a little bit procedure surgery. Same thing, you need to know when and how to go ahead and rejuvenate the body, because as we age, the support structure, just like the house, settles down, the bone changes, the fat changes, the muscles atrophy, and you need to do it. And you don't want to wait till it's down to the floor and then start doing it. You want to ideally enjoy it, and you want to do it in the right time. So you want to have the right patient, you want to have the right doctor who will not try to push you away from a procedure that would be good for you, because he doesn't know it and because he wants to make money and business on you. You want them to say honestly the way they would want someone to tell them if they were asking the question. And very often there is room for both. But when I sometimes see a doctor who, I was in Aruba on vacation, and hopefully she's not gonna watch it, but I was in Aruba on vacation, and this doctor, this lady passed by me and said, "Oh, hi Al, how are you?" And I'm like, who's that person? And I had to look at her significant other to realize the name of the doctor. Was like, oh, and she was different, man. They pumped her with fat. I mean, I know what it does because I don't do like that, but they pumped her fat, so yes, no wrinkles, but she was a moon face. Now, you know, there are races in Asia, they like moon face, but this doesn't belong in a Caucasian Jewish lady who used to be a V-shaped and then a little bit less than a V-shape. This is not a moon shape. So, you know, if they don't know how to do facelift or whatever, it doesn't mean that they need to just pump person up. Words are overdone. Now, the one center of person's face is the eyes. When you look at person, unless you have autism, you look into their eyes, you read what they really want. As kids especially, they look in their eyes, less on the lips. So they really know the truth. You can't lie to the kids, right? And the eyes, she's got gorgeous, gorgeous, gorgeous eyes. Look at the color, it's beautiful. But with time, the skin starts loosening and hanging, and she wanted to tighten it up. And the procedure lasts you for about 10-15 years, and then in 10-15 years you may need to do it again. The thing to remember is also to check the brows, because sometimes the brow is the issue and you don't want to keep cutting over here. What we did is we did this technique that I came up with internal sutures as well to give it extra support, and today it's only 4 days after the procedure. We did it Monday, so today is Friday, so 4 days after the procedure, and she's doing great because she's an amazing patient. Usually people don't do so great. I mean, there's a lot of swelling, a lot of hematoma. They ask how much downtime. Well, downtime is based on that, but you can see she's doing very well. And then with time, you will find that you cannot naturally just blow up the lips. You can put a volume, you can put filler in the lips, but after a certain time, there is no support structure there, and the distance between the nose and the upper lip gets wider and wider. And if you put the filler, it just looks vulgar and unnatural. And what you need to do is you need to shorten that distance. So when you look at the distance between the nose and the upper lip, it should be about 1/3, and this should be about 2/3 from the lower lip to the chin. The upper lip in a Caucasian should be about 1 to 1.6 to the lower lip. In African Americans can be 1 to 1, and it'll still be aesthetic. But in Caucasians, you want it to be about 1 to 1.6. Those are the parameters of perfect beauty. And again, you don't have to match them. You can be 1 to 1, but you don't want the upper lip to be bigger than the lower lip. So what we did here is we shortened a little bit the distance by doing a bullhorn lift. The bullhorn lift, why it's called a bullhorn, because it looks like the horns of the bull, and you hide it underneath the nose. And it lifted her lip nicely, and she's doing very well. Who put the cream underneath?
Monica.
Is she planning to remove stitches? We're not removing stitches yet. We put glue there, so you don't need to put any creams underneath it. It's fine, she put the cream, but we put the glue, so you don't have to do any care, so you don't have to do it at home. Okay. She probably forgot, because we put the glue, so you don't need to put the cream there.
Planning to remove something.
Correct. So we're just removing the stitches under the eyelids. We'd remove the bags with a special technique that I came up with. We didn't actually remove any skin. The reason we don't remove skin is because with age, with time, you lose the ability of the skin to retain its contact with the globe of the eye, and it starts retracting down. We call that a snap test. So if you pull it out and you pull it back and you hear like a click, a snapping test, that means it's strong. And if you remove that skin, and with age, everything kind of, the support structure goes down. As you get older, one of the problems is dry eyes. And if you cut the skin and you reduce the function without giving it extra support, it will with time get worse and worse, and you'll have worse dry eyes. So ideally, if you can avoid cutting the skin and just do it tightening with a laser if you need to, it's better. So we remove the fat, it's included already, we're gonna do the laser, CO2 resurfacing afterwards if she needs to tighten the skin. So right now we just lost the weight from the area, and it tightens by itself because she's got very good skin texture, she's taking care of her skin very well, and that's why it's good. And then the upper eyelids, usually we would remove 6 to 7 days, the sutures. And we also did a little bit neck lift and facelift, and there's a little bit of tape. She already removed it, she already cleaned it, and the chin. She didn't do that yet. So I'm just gonna have a look over here. Oh wow, this really is holding well. Sorry.
Feels good.
Without it, right?
The bandages come off.
Yeah, so you can see it's really nice, and there's little stitches over there. It looks like you can take out the sutures already. I tell you what. It's too soon though. In a week. You know what, I said 10 days. It's looking so good, you can probably take them out down in 10 days. In a week. And this is around the ears. She didn't remove that either, right?
No.
Okay. Sorry. And you can see the incisions very, very nice around there. And behind the ear they go. And she just has a little hematoma there, so it tries to stretch the skin. What we want to do is we want to put the pressure garment all the time on that area to heal it. And we put a little fat because there was an indentation that was in the cheek. Sometimes people, even with good material, can develop an allergic reaction to the filler, and she had an allergic reaction to filler, and they dissolved the filler, but when they dissolved it, they also dissolved, unfortunately, they used some steroids, and the steroids cause atrophy. We discussed that early in another situation where you have to be careful with the steroids because that causes atrophy of the skin and the fat, as well as other things. Not necessarily where exactly you want it, it spreads beyond it, and that's what happened. So she had an indentation, we filled it in, and it looks really very, very good. And we stored some of the fat, and in the process we also did a little extra. Everybody could benefit from a little liposuction.
Absolutely.
So we did remove a little bit from the sides to improve the waistline, and we used that fat, and the waistline also looks very good last time I looked at it. Did you notice it? Did you look at it? You didn't really.
I mean,
it's hard to, you're with a bandage.
Yeah,
you're with a bandage,
exactly,
that's right, that's
exactly.
right. So yes, you did very well, you did very well. And it's very important also when you do the ears to make sure that you keep the angle in the correct position to the face, and you don't have a pixie earlobe, so you have to suture it to the fascia underneath the ear and keep it. If it's a free earlobe, in her case it was free, and you see there's no tension on the ear. So she did very, very well. And we tighten it up here like that and here like that as well. So we just remove the stitches and we put the garment back on. Thank you for
Fantastic.
helping us educate and teach them.
Thank you. It's going to be like new me at 68.
You definitely don't look that, and
Yeah.
and most importantly is that you also will feel
Exactly.
feel that way too.
That I was bothered with the atrophy in this cheek.
Yes.
And then I said, like, as long as I'm doing this, I could see that the eyes needed the lift. And at that age was a perfect time to do tightening after you did, so I'm very pleased.
Wonderful. Was there any pain after the procedure? Can you tell them what you felt?
Well, after the procedure, actually the first night, probably I was still with the meds, because the first night I slept very good. The next night I felt like it was getting to me, the tightening,
the garment.
The garment was the hardest part, to be very honest.
Yeah.
But I guess I cope well with discomfort because I didn't even take any pain medication.
Amazing, amazing. But you also listened to us and you took the necessary pills that we gave you
to
help reduce the swelling and the bruising and all that stuff.
Right.
And it's important. So you want to have good results. It's not only dependent on the doctor, it depends also on the patient. You have to have a patient that follows the instructions. And that's how you get good results. When you start having issues is when I had like a patient in another room. She's like, oh, everything was perfect. I love that laser you did. Everybody said, look, I look like a baby. But there was one place where I decided to help and peel the skin off and it has a red spot. Perhaps she did CO2 on her face. So you need to
keep in mind that sleeping in an upright position is not the ideal position, but it's, you know, it's something I have to do.
For the healing.
I'm looking forward to sleeping normal again.
Soon. Thank you very much.
I'm great.
Thank you. You are wonderful. You are great. I agree. Thank you very much. Thank you. Yeah, I prepared the NAD already for myself. I prepared it so it's not going to hang around too long. I prepared it the night before. Then I did the right concentration that I need. In this case, it's 500 milligrams total. And I'm going to now put it into the IV bag with normal saline. Now, when you do exosome, you don't need to do that. But if, let's say, you have an issue like me where you don't sleep enough, your brain starts having trauma and inflammation, and this helps bring the inflammation. It's the best antioxidant. I shake it up, shake it up, shake it up. We're done with that. This is the IV bag. We're going to connect it now, and then I'm going to get the regeneral exosomes, and I'm going to use it for myself. And I'll explain to you as I'm getting the IV in. Just now I have to set it up. Don't want to hold you up. I'll explain to you why I'm doing it, the stuff that I've studied, and I'll show you some of the results afterwards of my genetic testing, which is methylation test, which is the most accurate way of analyzing the aging process, because they used to do the telomeres, which are the ends of your DNA protectors that every time the cell divides they become shorter and shorter, and it's been associated with aging. And I'll explain why it's important for the telomeres to remain longer, and how it's connected to youthfulness. Now I'm just gonna go set the IV bag, because it's usually not done in this room. I'll bring it here. Well, depending on the problem, first of all, always look for the root of the problem. You don't want to just throw treatments without knowing the root cause. It may be thyroid disease. You don't want to just... So most of the problems happen when people just suggest treatment without knowing the cause.
Could it be hereditary, or that's nonsense?
No. Everything is related to the genes also, but there's more than that in all those things. There's much more than that in all those things. So here we go. Sorry, I'm just gonna make sure there's no air in the IV tubing. I'm just gonna, okie dokie, that's enough. Just gonna open it up now and make sure that I prepare it without any air inside. So air will be pushed out with it. Slowly, you can see the air coming down with the water pushing it out. And that's it, no more air. Now there's still a little air in one spot. We'll just lock this here for a sec. A little air in here, right in the branch. So what I'm going to do is I'm going to suck the air out. Usually my staff prepares it, so after teaching them and them doing it so many times, I usually don't get involved with that. But if you get some air in, there'll be problems. So you can see me sucking the air out. Beautiful. I'm doing right now the NAD first. We put the IV in an IV bag, 500 milligrams. And since I haven't done it for some time, you know, every time you do it, it's a lot of energy. And it's kind of like, how fast can you push the energy into your body without feeling it? So if you go very, very fast, you feel like you ran a marathon and you're like out of breath. So your face starts flushing, getting red, tingling in the fingers, short of breath, that kind of stuff. It's completely safe. I've done it to myself in 27 minutes, which is really, really fast. First time around, I did myself an hour, 47 minutes. You know, and you feel like just a lot of energy goes into you, and it helps recovery, helps a lot of the pro fighters, the ones that are the cage fighters, they want to get back into the fight. They do it right after they've been banged up, and they get back up, and you know, it repairs everything really fast. So after I do this, I'm going to do the exosomes. So the exosomes, what they're able to do, if you're doing the right exosome, it's really, really key. Because when we say exosomes, we're doing a generalization. It's very important that the exosomes are taken from the right location. it's become kind of like a hype. And they're doing exosome from plants. And yes, a lot of our DNA is similar to plants, but you don't want to do that into your veins because we're not a tree, right? There are exosomes taken from your fat cells or from other people's fat cells. Well, they're not from the original source. It's kind of like you're doing research and you're quoting another person's article. And what if he didn't quote it correctly? What if he had a mutation there? You want to get it from the source. So what is the source? Well, when do we begin? When we're in the mother's utero, as an embryo, as a one cell growing slowly into multiple cells, eventually into amazingly, miraculously functioning human with 10 fingers, 10 toes, able to dexterity, etc. And we say, who is telling him the message? Who's sending him the message? And the message is being sent by the umbilical cord, by this bridge connecting the mother to the baby. And what is doing it in that bridge, what is telling the baby to properly develop, is the exosomes. So the exosomes are reach right around the artery and the veins that are sending the nutrition to the baby. And they used to think that this was all garbage. Then they realized it wasn't garbage, but each exosome carries in it microRNA, a little bit of nucleic acids, which are the building blocks of DNA, and also other growth factors, tens and thousands of growth factors that are important for the cell to properly develop. So what they do is they have a healthy mother, healthy baby, make sure that the mother doesn't have any disease, baby didn't have any disease, they check it for dengue fever, they check it for, all the stuff, the hepatitis, obviously, all these other things, because you don't want to infuse hepatitis. There have been some cases where they didn't test, and some companies and people develop hepatitis C from that, which we know can lead to cancer, so you got to be careful with that, which company you use. And after you check for, all those things, yellow fever, all the viruses, then you can go ahead and take from this mesenchymal stem cells, the stem cells that are located right around this Wharton jelly, that protective jelly around the umbilical cord that make it nice and soft. Then you can take the exosome from them, you spin it, you make sure a certain size goes, and then you have to test it, which takes a lot of money. And if you skip on any of those stages of the testing, of the size study, of checking every single batch that you do, you're increasing the risk of getting problems. I'm just making sure that it's still flowing. The risk of making problems with the person. The other thing that you have to make sure is that there are no live cells in there. Because if there are live cells in there, yes, you'll feel a little better, but that's where the issue is. So I remember about 30, 40 years ago, there was a question about using stem cells. Those stem cells were not pure stem cells. I don't know how they were being delivered, but people were excited about them. Now, stem cells are different from exosomes, very, very different. And they were saying, oh, doc, gotta use it. Look at me, I look so young. And I knew doctors who did it, and they looked phenomenal. Very, very young. Felt good. And then 10, 15, 20 years down the line, like I expected, like I told them, that's why I warned them, they start developing weird diseases, like ITP, idiopathic thrombocytopenic purpura, where nobody could understand why they're bleeding internally, why they're coagulating, and they start developing weird cancers, and in and out of hospital, nothing really works. I tell people that when you take a stem cell, unless you're not doing it very often and you're testing everything correctly and you really need it, when you're doing stem cells, it's kind of like inviting someone to help you, a rogue, someone to help you, like a mercenary army. So, the Russians now against the Ukrainians, they're inviting different mercenaries to help them, Chechens or whoever, to help them fight. Ruthless, behaving horribly, scaring people. What happens when they're done with the war? And you stop paying them, maybe. Who are they going to turn against? Maybe yourself, your own people, right? So all those elements that were at once you thought beneficial to you can go against you. And that's where I think, in a very generalized form, stem stem cells could be. Exosomes, on the other hand, is like saying, okay, here you need some extra growth factors so that you can function better. You need some more energy. These are the building blocks you need in order to be healthy and better. Here they are. You use them yourself. I'm not doing it for you. You're not sitting like on welfare. You are going and doing the work yourself. And that's where it comes in. And that's why, as I've explained before, when you give exosome to someone who is younger, it's going to be faster. It will work for all. You give someone who's older, they won't see the result as fast because the rest of their body doesn't function as well. Now, giving them the NAD will help because you give them the energy so their body can function faster and do what it needs to do better. But it's still going to take a little time. What I found in myself when I was doing it is that when I did my methylation test when I was 51, my overall age was 46, so I was younger before I started the treatment. My brain age was 58 because I wasn't sleeping 4 hours a day, sometimes less, a little bit more, chronically for many years. So my brain age was 58. Others was all younger than me, younger than 51, my chronological age. The muscles, heart, everything was much younger. Joints. So I decided to do this and see how it will affect me. And I did it, and I not only slowed my aging, so my aging speed compared to the general public was 91, the general. I slowed it to 81, my aging process. And when I was 52, I did my biological age, and it was 43. So I actually went back in time. And more importantly, my brain age, even though I was a year, it wasn't exactly a year, maybe 8 months, 6 months older, but I turned 52. My brain age went to 56. I was still older than my chronological age. But despite not sleeping, not changing my sleeping habit, it went and improved. I know it's one case, but I've done a lot of exosomes for other people, and even though they have not done the index test, the methylation test, it's an expensive test for them to do. Even though they didn't do that, I've seen them improve in function, improve in health when they were doing it. And again, it depends on how many also you do for yourself, exosomes, how many you do for yourself, NAD. So we're gonna right now inject myself with the Regeneral exosomes.